Klonk with this week's healthcare reform update for October 30th. I'm going to apologize up front. I'm a little bit under the weather today. I've been sick for the last couple of days. I was supposed to get my flu shot a couple weeks ago, but the vendor that we contracted with never got their vaccination. And I forget who they were supposed to get them from. Who's running that flu shot program again? Oh, that's right. The government's running that flu shot program. The same government that wants to take over my health care. So if my comments are a little jaded today, you'll understand why. Let's go over. We've had a very busy week this past week. On Monday, Senator Harry Reid released the details of the merged Senate bill. Biggest change that we didn't expect, quite frankly, was that there was a government option in the merged bill. We thought there would be a co-op, but there's a government option. A little bit of a modified government option. They have a government option, but the states can opt out. We don't anticipate in the states, most of the states wouldn't opt out if they did go ahead with that. And the immediate response from the Senate floor was Senator Lieberman came out with led a charge of several moderate Democrats to oppose the bill. The main premise for opposing the bill is they want to make sure they debate it on the floor. The way the Senate works, once you get 60 votes, debate ends. So they wanted to make sure it got to the floor at least so that they could debate it. The House will happen a little bit differently. The House can set a date or a deadline of debates or amendments, and at that point they'll call it quits and majority rules. And the House has set theirs as November 11th. The Senate will go to the floor and they will debate until they get 60 votes, and once 60 votes happens, it will end. So yesterday morning, House Speaker Pelosi released the House bill, which is titled the Affordable Health Care for America's Act. And it is 1,990 pages long. Anybody wants me to send it to them, please write me. A lot of things in this bill. We don't have time to cover them all. I'm going to try to cover a couple key elements of the House bill. First of all, as we said last week, it does have a public option in it. A little bit scaled back, again, trying to appease the moderate Democrats in the House. The biggest difference in their public option is not going to mandate Medicare fees or reimbursement rates, I should say, for hospitals and docs. What it'll allow is for a negotiated rate with the hospitals and docs, but it'll actually end up probably being Medicare plus 5%, which still, based at that level, most hospitals and docs can't make money, and the private insurance industry will subsidize that program just like we subsidize Medicare and Medicaid today. There's many changes that are phased in over the course of from 2010 through 2018 for the House bill. Let me cover a couple of them for you. First of all, there is an employer mandate in the House bill. 8% penalty for employers with payroll over $750,000. If you don't offer health insurance, they'll kick you. They'll tag you for 8% of payroll. Post-retirement benefits for employees. You can't cut them unless you cut active employee benefits. That will go into effect. COBRA will be extended through 2013 for all participants, and that will go into effect immediately upon passage of this. It's to coincide with when the health insurance exchange would start, which is also in the House bill. I'm not sure if the subsidy for COBRAs will continue, but COBRA would be extended to 2013. There's many positive things in the House proposal. I want to cover a couple of them. First of all, it would establish immediately a high-risk pool for the uninsured. So if you're uninsured, been out of insurance for the last couple of months, you would be able to go into a federal pool for that. Small businesses are exempt from the House proposal, so payrolls under $500,000 would be exempt from any of the mandates in the proposal. It bans lifetime benefits for insurance carriers. So today, if you have a $2 million lifetime benefit or a $5 million, that would be released and there would be no ban on lifetime benefits. It gradually eliminates pre-existing conditions starting in 2010 through 2013. Also extends the dependent age through age 26. And it establishes grant programs for wellness, which we've been pushing for a lot, and finally they're going to listen and they're going to establish grants for employers who offer wellness programs. The negative part of that is the House proposal does have the community rating phase to it, as we talked about last week. Not a lot of incentive to offer wellness programs if you're going to be community rated like everybody else, so I'm not sure exactly how that's going to work. And gosh knows the best thing about the House proposal is it finally imposes a tax on all those wealthy people. 5.4% tax on anybody making over $500,000 to help offset the cost of this program. Biggest question, at the end of the day, you can read, I've read all the summaries, read everything else like that, how are we going to pay for it? President Obama stated he didn't want anything to cost over $900 billion on health care reform. It's a miracle that every single proposal that comes out of the House or the Senate now is less than $900 billion. This one I think was scored at about $893 billion or something like that. But they forgot one little thing. This, if you've been paying attention last week, they called it the doc fix. On January 1, there was supposed to be a 21% cut in Medicare reimbursements for doctors that was supposed to go into effect. That was going to save $240-some billion over the next 10 years. Well, They don't want to put that in effect. In fact, every year they pretty much waive that cut. So that $247 billion that's going to cost for the next 10 years, they're going to take that out of the healthcare reform package that would push the cost over $1 trillion, and they're going to make it a separate provision. So watch for that to come into play. The other issue is that they talk about the 10-year cost of this being less than $900 billion. It's really not a 10-year cost. It's a 6-year cost. Subsidies don't start until 2013. So if you really take that over 10 years, it's well over $1 trillion. And at the end of the day, President Obama said in his speech back in September that the idea of healthcare reform is that he was going to reduce the cost for healthcare for all of Americans. People are covered today, people aren't covered today, and there's nothing in these proposals, if you read them closely, that's going to reduce the healthcare costs for you or I today. The 85% of people who have coverage today, it's not going to reduce their costs. Yes, it is going to provide some access for other people, but at what cost? That's my biggest concern with what this is. We don't have time to go into any more detail today. What we are going to do is Monday morning we're going to send you an outline of both the Senate and the House provisions. We're going to try to make it in English language, very simple, easy for you to read. Look for it in your email box on Monday, and we'll cover next week's update on some of the key elements of that. Until then, have a good weekend. Thanks for listening.